Okay, so we need to talk about digital stimulation. Sorry. Okay. Digital stimulation is a whole training procedure, and it's when the patient voluntarily loses control of their bowel, because of a damaged spinal cord. And so what you do is take all your equipment and then you set it aside, and you take your glove, put lube on your index finger, and then insert 1 to 1.5 inch of your index finger into the anus or anal, and you do the circular movement. It's just like a massage to help it relax. Will help the muscle relax. And so you repeat that 2 times every 5 minutes. So 1 5-minute session and then another 5-minute session. And then, and then the lube helps too. And then you continue that. And then it's 3 times. And then you take the bowl, if they do, take the patient into the bathroom, and then seat them in the toilet, and then
hopefully they go.
Yeah.
So you're stimulating basically like the
stimulating nerves.
Just like the babies, right? You do that with cotton buds when they...
And sometimes when they're impacted, we have to actually go in and evacuate the stool.
With your fingers?
Are, can we do that?
It gets hard like
We can't do that.
like rock.
Nurses.
Doctor did that to my daughter.
And
There's
nurses
something about spoon juice helping.
Can they just get a laxative or something?
He suggested.
But
I guess that's more
sometimes
severe when they need
An actual stimulation.
I think Dara had to do that because she mentioned having to stick her fingers in someone's...
and it's because they've lost
butt.
sensation from their spinal cord injury or trauma. But when the patient's impacted, what happens is they keep giving the patient laxatives, so it's all watery. Once you remove that hard ball,
Then it just
stool,
falls
then
out.
It just,
Oh, it's like the...
I mean, it's literally like ball, and it's so uncomfortable to be impacted. It's the worst feeling.
We can do digital stimulation?
But not...
I hope not.
Not this impact. I've only done it a few times. I mean, where I had to really go in and evacuate the stool from the rectum.
Well, what if your fingers aren't long enough? What if your fingers aren't long enough?
Well, once you get it softened up,
Yeah,
the
it
patient
moves forward.
Oh, they'll be
moves
able to
forward,
go.
and then after, if you
Or
do
you can
digital
help
stimulation. And most patients who are on this are on a bowel program, one day with a suppository, and then the next day they might do digital stim, especially with paraplegics who've lost the...
Oh, yeah.
Very good.
Is this done every day? Or
As
serious?
One time.
one time only?
As needed. I don't think they need to be done every day.
Because they have more time.
Because they're on a bowel regimen, so they're getting laxatives,
Juice.
prune juice, high fibrous foods, and then they're also
They also use the suppositories for that, right?
Mhm. So one day they might get the suppository,
And
and the next day they might have to have.
But they can't
digital.
have both at the same time.
You could, but you'd want to wait till the suppository melts so it does its
It's job.
purpose, its job.